Chapter 35. Digestive Disorders. Every healthy person enjoys eating. This is one of the pleasures of life. Mealtimes are generally happy social occasions. But they are important for other reasons as well. How we choose and prepare our foods affects the way we live and the health we enjoy. Suggestions on choosing foods and balancing the diet are more fully discussed in earlier chapters of this book. In this chapter we review the common digestive disorders and what to do about them. Digestion begins the moment food is introduced into the mouth. Within the mouth a certain chemical called ptyalin is added to the food from the saliva. This begins to break down the starches into less complex forms so that eventually they become the simple sugars known as maltose, dextrose, and glucose. Unfortunately, many people fail to make use of these valuable enzymes within the mouth. Because of nervous tension, they swallow their food without properly chewing it, and then wonder why they suffer from indigestion. The mere act of chewing would help to relieve their tensions and also aid in digesting the food. Bad teeth and halitosis. Nothing is more objectionable than bad breath. Unfortunately, most people who offend in this respect are completely unaware of their problem. One common cause of trouble is bad teeth. Dental decay at the roots of the teeth may result in abscesses in the gums with foul-smelling pus giving an objectionable odor to the breath. Even small holes in the teeth may provide a place where germs can multiply and release foul odors. These are very common in younger people. Badly fitting dentures that have not been properly cleansed are a common cause of trouble, especially in older folk. Bad tonsils and infections of the adenoids and sinuses may also play a part in this. Odors may also arise from inflammation in the stomach, and also from food materials that have not been completely digested. Swallowing difficulties 315. Treatment: see a good dentist at once if you have any cavities in your teeth. Your doctor will advise you concerning the condition of your gums, tonsils, adenoids, sinuses, and other parts that may be the source of offensive odors. A wholesome, well-balanced diet will go a long way toward preventing trouble. All decayed teeth should be properly filled or extracted. Such a decision should be left to a qualified dentist. To choose a simple, wholesome diet with plenty of fruit is one precaution all can take against offending other people with halitosis, or bad breath. Difficulty in swallowing. Swallowing is a complicated process requiring the smooth working of a number of muscles in the throat, face, tongue, and palate. Any disease process in these areas may interfere with normal swallowing. For instance, any congenital defect, such as a cleft palate or a narrowing of the esophagus, may interfere with normal swallowing. This is also true in some who suffer from a diverticulum of the esophagus, or food pipe, leading to the stomach. Any tumor, such as an enlarged thyroid gland, or an aortic aneurysm, or even cancer, may interfere with normal swallowing. Large food masses or foreign bodies, such as fragments of bone, sometimes become stuck in the esophagus and have to be removed through a long tube known as the esophagoscope, or else partially dissolved by some chemicals such as papain, so that the food mass can pass down into the stomach. Difficulty in swallowing sometimes follows certain diseases, such as polio, diphtheria, syphilis, or various forms of poisoning, alcoholism, and also hysteria and other mental disorders. Elderly people suffering from a stroke may also have difficulty in swallowing. Instead of liquids going down to the stomach, they may flow back through the nose. This is a most distressing situation, particularly if it continues over a long period of time. Spasm in the lower portion of the esophagus may also be responsible for trouble in this respect. If this continues over a long period, the esophagus may become greatly dilated, and the condition may have to be relieved by surgery. Another condition that may cause difficulty in swallowing is esophagitis. This is an inflammation of the lower end of the esophagus, due to too much acid in the stomach. It is often associated with 316 digestive disorders. Gastritis and peptic ulcer. Sometimes a portion of the stomach is located in the chest. This is known as hiatus hernia or diaphragmatic hernia. Fullness of the stomach or pressure on the abdomen may cause part of the stomach to move up into the chest. In such cases there is often a feeling of distress, and there may also be bleeding at times. Indigestion or dyspepsia. People with indigestion complain of a number of different symptoms, such as nausea, heartburn, upper abdominal pain, and flatulence or a sense of fullness in the abdomen after eating food. These feelings of discomfort often come on after eating too rapidly or not chewing properly. The trouble is sometimes due to lack of teeth. Emotional upsets and severe mental strain are also common causes of gas and indigestion. Constipation may interfere with the normal flow through the gastrointestinal tract, and often causes gas and abdominal pain. Certain foods, especially if they are poorly cooked, may cause trouble. Some people react unfavorably to beans, cabbage, onions, cucumbers, radishes, strawberries, and various seafoods. Fried foods often cause gas and abdominal discomfort. Excessive smoking is another cause of trouble. Many nervous individuals rapidly gulp down their food and swallow excessive amounts of air as well. Carbonated drinks release a lot of carbon dioxide gas, which may produce a sense of fullness in the stomach. This in turn can produce a sense of smothering and palpitation, leading folks to think they are having a heart attack. Gas within the intestines may be due to fermentation and actual decay of food within the intestines. In all such cases, it is advisable to have a complete X-ray of the stomach and bowel to be sure nothing more serious is present. Treatment: begin by choosing a well-balanced diet. Be sure the food is well prepared and thoroughly chewed. If at all possible, allow a full hour for a meal. Avoid all haste while eating. Meals should be served in a pleasant, relaxing environment, free from undue excitement and smoking. Constipation should be corrected by using enough bulk in the diet, and possibly by some suitable laxative such as milk of magnesia or a small quantity of cascara. Belladonna products, such as belladonna, are of real value in relieving this condition. Treating indigestion 317. In a few patients there may not be sufficient hydrochloric acid in the stomach. This can only be determined by the use of a gastric analysis. If no acid is found, the condition may be relieved by the use of hydrochloric acid in the form of tablets, acetylpepsin, given before each meal. Simple antacids, such as Gelusil, can be given to relieve stomach distress, particularly if there is too much acid. 318 Digestive disorders. Gastritis. Gastritis is an inflammation of the lining of the stomach. The patient usually complains of pain, loss of appetite, nausea, vomiting, headache, and dizziness. The trouble may follow taking alcohol, spices, certain drugs, strong acids, or caustic substances. It may sometimes follow measles, diphtheria, virus pneumonia, and enteric fever. Prolonged nervous tension may also result in gastritis. In the more chronic forms there is a feeling of fullness in the abdomen, particularly after taking food. The patient also complains of heartburn, nausea, and vomiting, and occasionally hemorrhage from the stomach. Prolonged illness often results in loss of weight. In a few cases a small ulcer may be present which is not seen on X-ray. However, the patient should always have an X-ray made to help in diagnosis. People with pernicious anemia may suffer from atrophic gastritis due to loss of the intrinsic factor normally present in gastric juice. Patients who have too much acid are likely to have ulcers. Hence it is wise to have a gastric analysis. Treatment: avoid anything that irritates the stomach, particularly alcohol, nicotine, spices, condiments, aspirin-like drugs, and harsh laxatives. The diet should be bland, similar to that suggested for peptic ulcers. See page 321. Extra vitamins are recommended, especially B if there is any suggestion of pernicious anemia. Patients who are bleeding from the stomach should be put to bed with an ice bag over the abdomen and kept quiet until the doctor comes. In cases of massive bleeding with black tarry stools, take the patient to hospital for appropriate treatment including surgery, if this is indicated. Peptic ulcer. Peptic ulcers are among the most common of all conditions affecting the human race today. They occur fat more frequently than many people believe. Even young children may suffer from ulcers. In adults, ulcers of the stomach are more common in women, while ulcers of the duodenum, or first part of the bowel, are more common in men. What is a peptic ulcer? Actually, it is an ulcerated, or eroded, area of the mucous membrane that lines all the digestive organs. It occurs most frequently in the lower end of the stomach, first part of Peptic ulcer 319. The duodenum, or lower end of the esophagus. All factors involved are still not known. But ulcers almost never occur in patients with low levels of hydrochloric acid in the stomach. The stronger the acid, the greater the likelihood of an ulcer. Emotional tensions, such as those brought on by family arguments, seems to play a large part in the development of ulcers. Usually there is only one ulcer, but occasionally several may be present in the same patient. Most ulcers are small, probably less than half an inch across in the duodenum, and perhaps 1 inch across in the stomach. Ulcers in the duodenum are rarely malignant, but one ulcer in every 10 occurring in the stomach may be malignant. 320 Digestive disorders. The most outstanding symptom of an ulcer is pain. It is usually sharp and severe. In a few cases there is also a steady aching or gnawing sensation in the upper abdomen. The patient can always put his anger on the sore spot. In duodenal ulcers the pain comes on when the patient is hungry, it may even be severe enough to awaken him at night. In many cases the pain is relieved by taking food, but is made worse by taking alcohol, condiments, and coffee. Patients with stomach ulcers may feel worse after taking food. Sometimes the ulcer may not be noticed for several weeks or months, only to flare up again under emotional strain or after taking alcohol. Another symptom often associated with an ulcer is heartburn, or inflammation of the esophagus. This is more fully discussed on page 315 to 16. Because of spasm the stomach cannot empty itself properly, so that the highly concentrated hydrochloric acid SPI11S up into the esophagus, perhaps even forming an ulcer there to aggravate the situation. Diagnosis. A correct diagnosis is most important before beginning any treatment. In addition to the history of pain, burning, gas, and other symptoms, a complete X-ray of both the upper and lower gastrointestinal tract should be made. Usually the ulcer can be seen, but in a few cases the X-ray may fail to show any convincing evidence of the ulcer. The size of the ulcer is important, especially if it is in the stomach. If the ulcer is very large, it may be necessary to remove that portion of the stomach, particularly when there is any suspicion of cancer in or around the ulcerated area. In any case, the doctor will probably want to repeat the X-ray in 3 or 4 weeks to see if there is any change in the size and shape of the ulcer. If it is getting larger in spite of medical treatment, it may be well to undergo surgery. If, on the other hand, normal healing appears to be taking place, a further trial of medical treatment is wise. Treatment. The most important thing is to heal the ulcer and prevent it from coming back. This means a period of both mental and physical rest to allow the stomach to heal. For large ulcers in the stomach, the patient should remain in bed, or several weeks, preferably in hospital. If a repeat X-ray fails to show normal healing within the stomach after such a period, the trouble may be due to cancer, and the suspected area should be removed. Ulcer Treatment 321. Large duodenal ulcers are also best treated in hospital during acute stage, particularly if bleeding has occurred. Following this, bed rest at home for 2 or 3 weeks may bring the ulcer under control. One must carefully guard against serious complications, the worst being perforation of the ulcer, followed by severe hemorrhage and shock. Diet is most important in the treatment of ulcers. During the acute stage it may be necessary to take a liquid diet every 1 to 2 hours for a few days. Milk is best for this purpose, for it provides both protein and calcium in adequate quantities to aid healing and support the whole system. Medications given are usually belladonna products, such as belladonal and also probanthin, both of which have a soothing, healing effect on the digestive system. As the patient improves, other foods, such as bland cereals, mashed potato, and simple desserts, should be added to the diet. Gradually he can return to a more complete diet, provided the pain remains under control. Patients not responding to good medical treatment are often advised to have surgery. One is the pyloroplasty and vagotomy operation. This often relieves the spasm at the outlet of the stomach. Another is the subtotal gastrectomy, which is done to eliminate the ulcerated area and remove the acid-producing part of the stomach, thus preventing further erosion of the mucous membranes. The vagus nerves are also severed to reduce irritability in the stomach and lessen the chance of AD being produced in other areas. After this particular operation, some patients are troubled with dumping syndrome, in which weakness, dizziness, sweating, nausea, vomiting, and palpitation may occur. Some ulcer patients, as well as those who have undergone surgery, may be troubled with vomiting of blood and tarry stools, due to the presence of hemorrhagic gastritis, referred to on page 318. Or perhaps the ulcer has eroded into a blood vessel, causing serious hemorrhage into the stomach or duodenum. Peritonitis may also occur if the ulcer has eroded clear through, allowing the gastric juices to spill out into the abdomen. These are all serious complications that can only be adequately treated in hospital. Patients with ulcers should always note the condition of the stools. If they appear dark or black, the condition should be reported to the family physician at once. 322 Digestive disorders. All ulcer patients, including those who have had surgery for this condition, should follow certain rules of life. They should not smoke. Tobacco is an irritant and always aggravates the digestive organs. They should not use tea, coffee, or alcohol. They should avoid fried foods, roughage, chilies, spices, and all hot seasonings. For beverages, it is best to use milk, water, and fruit juices. Above all, try to take sufficient rest, avoiding all nervous tension as far as possible. Cultivate an atmosphere of confidence and hope. Learn to live one day at a time. Be tolerant in viewing the shortcomings of others, avoid all resentment. Learning to forgive others without their asking will not only promote healing in the ulcer but will also bring satisfaction and true peace of mind.